Millions of American families are struggling with an unrelenting addiction to controlled substances. That's really nothing new, and that's the unfortunate part about it. But after decades of taking the wrong path toward treating drug abuse, it appears we're finally in the midst of a fundamental shift in the way we're going to focus and approach this issue. For years, we simply considered drug abuse as a crime. We dealt with it by police, prosecutors, and prisons. There's now, however, near consensus that addiction has to be viewed as a public health issue. This requires coordinated investments in prevention and treatment. Law enforcement agencies would rather not arrest the same offender over and over without dealing with the underlying addiction. Treating that addiction, more than just punishing the addict, is often the more effective and more humane, and certainly the less costly approach. Much of the country is now confronting a rising challenge: addiction to heroin and powerful painkillers. My home state of Vermont has not been spared. It attracted much attention for its struggles with opioid abuse. In fact, the film The Hungry Heart provides a powerful portrayal of the damage this addiction has inflicted on Vermont families. I was honored to host a screening of this moving film with Michael Botticelli last May. But in many ways, Vermont's ahead of the nation. We in Vermont long ago recognized the problem. We began to develop new approaches to address it. Dedicated Vermonters, working in the traditional roles of prevention, treatment, and law enforcement, came together around common goals and shared strategies. Community partnerships have produced very successful programs, innovative programs, such as the Rapid Intervention Community Court in Burlington, Project Vision in Rutland. I've held hearings of the Judiciary Committee in a number of places in Vermont. Mr. President, as a lifelong Vermonter, what really touched me, everybody came together for those hearings. Republicans, Democrats, independents, law enforcement, defense counsels, clergy, teachers, medical professionals, parents, and often those who have been abusers. They realize there's no single answer, but we can do it better than we have for decades. First responders, for example, are saving the lives of addicts throughout the state by carrying naloxone. This will save their life instead of some who would die of an overdose. Evidence-based prevention treatment services have been extended in all corners of Vermont. But the barriers to recovery have been significantly reduced. That's the most important part. Now, these are all strategies the ONDCP promotes. Mr. Botticelli understands that success requires an increased commitment to early intervention and education, treatment, and smart criminal justice policies. And while the scope of the challenge is immense, Mr. Botticelli has us going in the right direction. Having listened to him, having talked with him, I'm really hopeful he'll get us ahead of addiction, help end the misery it inflicts on individuals and families in our communities. I urge my fellow senators to vote for his immediate confirmation. Mr. President, I would ask consent that my whole statement be made part of the record.
Without objection.
And Mr. President, I would remove my earlier request that this be in morning business. I realize we are on confirmation at this point, and I ask the whole statement be ahead of Mr. Botticelli's vote.
Without objection.
I thank the chair. I see nobody else seeking recognition, so I suggest the absence of a quorum.
The clerk will call the roll.